My name is Sir Christopher Edwards, and I'm the chairman of the Chelsea and Westminster NHS Foundation Trust. The reason I'm talking to you is to underline the importance that I place on research. Research is key for the success of modern medicine, and this can only happen if people like you understand that you can play a major role by being part of our research programs, and by doing so can help not just yourself but help other people.
My name is Neil Sony. I'm a consultant in anaesthesia and intensive care. The only way medicine continues to progress is through research. Medicine isn't just about delivery of healthcare, it's about continual improvements in how we deliver that healthcare, and the only way we can know that is by making sure we look at what we're doing. Research encompasses that. It's not just new drugs or new bits of equipment. The vast majority of research is about what we already do and how we can improve that so it's better for you as patients and you as relatives.
As a patient, you expect and deserve the highest standard and quality of care possible from the hospital. As healthcare professionals, we strive to deliver that standard of care to you, ensuring that what we do is safe, effective, and meets your satisfaction. To achieve this level of safety and effectiveness, we need to use treatments that are proven by research. Here at the Chelsea and Westminster Hospital, we are increasingly carrying out research to establish which are the best treatments and to discover new treatment options. By participating in a clinical research trial, you are helping us to improve care, to develop new ways to treat conditions, and to ensure safe and effective methods are used in the future. Several research projects are ongoing at Chelsea and Westminster. Please feel free to ask about these. In some circumstances, we might ask you to see if you're interested in helping us with our work. In this case, your pre-assessment nurse will be able to contact a member of the research team. A number of research nurses work here who make sure our projects run smoothly from day to day. They are very well informed about each study and can discuss them with you, giving you all the information you need and answer any of your questions.
My name is Professor Derek Bell. I'm Director of Research at Chelsea and Westminster Hospital. I feel I'm in a very privileged position in that I'm able to create and support opportunities for patients to participate in clinical trials and also for staff to conduct clinical trials. Over the last 3 years, we've seen a dramatic increase in the number of patients participating in clinical trials, and we're now beginning to be able to report real benefits for our patients.
Hello, my name's Mary Tourette and I'm Head of Research and Development here at Chelsea and Westminster Hospital. My team is responsible for managing and approving clinical research. Our job is to make sure that all the research that is conducted in the hospital is safe and that the welfare of the patients is always the most important thing.
On the day of your surgery, you will be looked after by our staff on the ward. Our research nurse will be present to ensure you are still happy to participate and to check with the medical and nursing staff about your care. It's important that you are aware of any benefits or potential risks of participating, and we will go through these with you to make sure you have all the information you need and are happy to proceed. A member of the nursing team will make sure that we have all the information we need by taking a detailed history of your health and doing some simple tests, like checking your blood pressure and blood sugar. You do have the right to refuse or withdraw from the study at any time, and your care will not be affected. Our research nurse will talk to a member of the ward nursing team to confirm that you are participating in one of our studies. Before we start your anaesthetic, you will be asked a number of routine questions for your safety. The theatre team will have been informed already of your participation in the research study. After your operation, you will be cared for on the ward by our medical and nursing teams. The research team will visit before your discharge to check on your progress and ensure that we have all the samples and information we need. When you're ready to go home, your doctor will discharge you from hospital. The research nurse will give you any additional information and instructions you need, and will discharge you from the study. We may contact you after discharge to follow up on your progress, either by phone or by post.
So the driver for research is to improve healthcare. The benefits of this research are real, and the beneficiaries are you as patients and you as relatives. That means us as well, because doctors are often patients and relatives too. The question one would ask is, would you participate in a research project? Would you let your relatives participate in a research project? And the answer to that is clear: yes, I would, because it's very important to me that everyone undergoing healthcare is helping to improve the future for everyone else. In essence, we need to do research, you need us to do research, we need your help.
Please see www.chelwest.nhs.uk/research for further information and contact details of how to get in touch to find out more. We do hope this video has been useful in answering some of your questions about participating in our research work.